Presentation number 11 in brain neoplasm series prepared by Prof. Sharaf and revised by Prof. Ram Edward. It is for the pineal body tumors, pineal gland tumors. Pineal gland is a midline structure, pine-cone shaped, considered to be part of what is called as epithalamus. Typically measures around 7.6 by and 3 millimeter in size. That means an average of 5 millimeter, and is situated in a groove between the laterally placed thalamic bodies. Under the age of 5 years, no calcification is there. That the gland enhances as it is outside the blood-brain barrier. Pineal tumors, accurate preoperative imaging diagnosis is usually not possible. Germinomas are more common in males. A homogeneously enhancing pineal mass in a young male is most likely germinoma. Intratumoral fat is seen in teratomas and dermoid cysts. Strong restricted diffusion is seen in epidermoid cysts. A pineal region mass with dural attachment is a meningioma. Otherwise, we might need biopsy. So we have now germinomas. We have the when we have the teratomes and dermoids with fat, we have the restricted epidermoid, and we have the dural attachment of a meningioma. These are the main lesions of the pineal gland. Normal pineal gland is no more than 5 millimeter. In children below 5, there is no calcification, but if it happened, it reaches a plateau around 30 years of age. It is present between the two thalami. Here it is, and this is the typical appearance of the pineal gland in T2 weighted images. Seen as a cyst of more than 1 centimeter. Here is another cyst in T1 weighted images, and here is a third cyst compressing the quadrigeminal plate with some enhancement of the margin. Pineal lipoma, this is the one, the black one here, pushing the pineal calcification forward. This is a pineal germinoma, where we have the mass invading the third ventricle, which should be slit-like. It is invaded and pushed forward by the mass, so there is soft tissue mass here, associated with hydrocephalic changes due to obstruction of foramina of Monroe, this one and that one. So the ventricles are dilated, the third ventricle is invaded and pushed forward by a pineal germinoma appearing in a previously calcific pineal gland. This all is the tumor. The tumor is delineated here by CSF in the third ventricle, pineal germinoma. Pineal germinoma, another one with enhancement. And as we said, germinomas are more common in males. Homogeneously enhancing pineal mass in a young is most likely a germinoma. Here it is, and here is the homogeneous enhancement, pushing into the third ventricle again, and resulting in hydrocephalic changes. Biennial germinoma seen enhancing in T1 weighted images. Biennial germinoma seen enhancing in T1 weighted images. Biennial germinoma which is infiltrating due to lobulation, it is extending forward into the third ventricle, which is converted into a thin slit with associated hydrocephalic changes, and it extends backward here to involve the region of aqueductive sylvius and the adjoining part of the fourth ventricle. So a lobulated enhancing mass at the region of the pineal gland, which is usually located, can be identified by the location being between the two thalami, is the pineal. So enlargement, swelling of this region with enhancement in the T1 weighted images. Could be a small mass, could be a large mass, could be lobulated mass like here, extending into the CSF spaces surrounding and compressing the third ventricle up, denoting pineal germinoma. Another pineal germinoma, circumscribed mass, hypointense in T2, but increasingly enhancing, intensely enhancing in T1 weighted images, with edema of the nearby thalamus. Thalamus on the right and left side are edematous. Pineal germ cell tumors include also embryonal carcinoma. We have a lot of terminology. All are heterogeneous and enhanced. All show heterogeneous pattern and heterogeneous enhancement than pure germinomas. Heterogeneous pattern and heterogeneous enhancement. You can have what this term pineal germ cell tumor. So germinoma is rather homogeneous and well localized, but it may be lobulated and invading. Pineal germ cell tumors tend to be heterogeneous and tend to be heterogeneous in pattern and enhancement, of course with associated hydrocephalic changes and encroachment on the third ventricle. Pineal tumor is partially cystic, partially enhancing, with nodule, and astrocytoma could be the diagnosis. Pineal tumor is partially cystic, partially enhancing, solid with cystic area, solid but showing subarachnoid seedling, this one and that one, subarachnoid seedling. Here especially it's evident, could not be mistaken, and this is a pineal tumor. Could be a germinoma enhancing solid mass at the region of the pineal body. In adult is a germinoma till otherwise proved. In teratoma we can see fat mass with tumoral calcification and fat. This is teratoma. It is as a region of the pineal again, encroaching on the third ventricle and show a fatty component like arc configuration with contrast enhancement. This is teratoma. A teratoma with fat component at the region of the pineal, showing also calcifications. Two calcifications and fat. The presence of fat point to the diagnosis of pineal teratoma. Another one with cystic changes and fat component at the region of the pineal. It's a teratoma, heterogeneous. Solid pineal tumors may be a blastoma, which is aggressive tumor, usually hyperdense in CT and calcific in non-contrast CT, and we have these different cases. Here it is, 1, 2, and 3. If you say this is a solid pineal tumor, it's good. You just check the anterior encroachment on the third ventricle, the posterior encroachment on the superior cerebellar systole, and the presence of hydrocephalic changes with CSF permeations. And you have to describe the heterogeneity or calcifications. So it may be faintly calcified, densely calcified, or heterogeneously calcified. And this is pineoblastoma. Solid pineal tumor, pineoblastoma, is large lobulated, hypo NT2, intensely enhancing in contrast enhancement. T1 weighted images. Again, if we say germinoma, we are not away from the correct diagnosis. Now, vein of Galen annular malformation is a different story. It occurs at the same region, but it's a flow void structure at the region of the Galen, vein of Galen, which is the confluence of the two internal cerebral veins, should be here in this area. This is a vein Galen aneurysm or malformation, seen as flow void in MRI, T2 weighted images, and seen as hyperdensity in CT due to altered blood. A large cyst, which is following CSF in all sequences, will be considered a large arachnoid cyst, centered on the region of the pineal, associated with hydrocephalic changes and continuation with the inseparability from the third ventricle. Thank you.